Okay, class, this is part 2 of the presentation. This is the review for chapters 1 through 4. This is the slide that ended the part 1 presentation. The next root operation I wanted to highlight in this talk was the root operation of destruction. It is defined as the physical eradication of all or the physical eradication of a portion of a body part by the direct use of either energy, force, or destructive agent. So this is important to note because this particular root operation is telling us that the physician is not using a scalpel or some type of cutting instrument such as scissors or something like that. An alternative term for the root operation destruction that you may see in the clinical documentation is coblation, which is a non-heat process using radio frequency to break down organic material. Cryotherapy, fulguration, or other types of terminologies that also relate back to this root operation of destruction. So a procedure example would include cryotherapy of the warts of the hand, radiofrequency needle ablation of endometrial fibroids. So again, the physician most likely is not going to use the term destruction when he does cryotherapy. He's going to call it or document it as cryotherapy. You have to become familiar with these synonyms, so to speak, as far as ICD-10 is concerned, so that you understand how to apply that back to one of the early steps of your coding process, which is identifying the root operation. The next root operation is extirpation, which is defined as the taking out of or cutting out of solid matter from a body part. That word solid is very important. I think all of us know what a foreign body is, like a bullet or a piece of wood or a piece of metal. The other element that ICD-10 PCS clinically considers solid is a blood clot or a thrombus. But things like cyst or mass is not necessarily a solid piece of material. A cyst is basically a sac and it has in it fluid and sometimes some soft tissue, but it's not solid. A mass is a conglomeration of soft tissue. The words soft and solid are not related. Another common solid matter is a kidney stone or gallbladder stone. Another word for stone is calculus. So you have to understand all these little synonyms as you're moving through the coding process. The root operation identified specifically as extirpation typically will not be documented by the physician with that word spelled out. So you have to be able to know that this patient had, some type of shrapnel, piece of wood was embedded in their leg, and the physician dug it out. That would then relate back to this particular root operation. When we talk about kidney stones, bladder stones, those pieces of clinical disease are going to typically, sometimes, not all of them, typically be broken up. And then we have to be careful because if the physician does a procedure called a lithotripsy, which is going to break up, for example, a kidney stone, sometimes they'll break them up small enough, and they typically do an x-ray to see the sizes of the stones before and after the procedure, the lithotripsy. And if they're small enough, they can basically not 100% guarantee, but pretty much hope and know that those pieces of the stone will pass out of the patient's body naturally. Sometimes they don't break them up small enough, or they get lodged, especially when we're talking about gallbladder stones, The gallbladder stones, they break them up, they move around, and they get lodged in the bile duct, and they're not going to move. They're not going to naturally be eliminated from the patient's body. So the physician then has to go in, the surgeon has to go in and retrieve the stones that he broke up, the solid pieces of matter. So again, the intention is to get those stones out the patient's body. And how is that going to be done? The lithotripsy, in the case of, for example, gallbladder stone, it has now been broken up by lithotripsy, but now it has moved and it has lodged in the patient's bile duct, and it's stuck in there. If they leave it there, it's going to cause necrosis. That piece of the bile duct is going to die because there's something stuck in there and there's no blood flow. So the surgeon has to go in and get that. The objective is to remove that piece of stone lodged in the bile duct, which happens to be a piece of gallbladder stone. That then becomes a root operation extirpation, because the lithotripsy didn't remove it from the body. The lithotripsy broke it up, and the physician then had to go get it and remove it from the patient's body, the stone. So again, remember, the root operation is the intention of the procedure that you are coding at that particular moment in time. So if we look at chapter 3 and look at one of the case studies, in your textbook, the authors, to make a distinction between the different types of exercises, decided to call the operative reports case studies. But again, as you are coding, these are very good practice for how you would really see this clinical information in an actual record. So in this particular case, the patient has been found to have a left adrenal tumor. We're just coding the procedure side, so the fact that the patient has a benign or malignant tumor doesn't impact our code assignment on the procedure side. That information would impact our diagnostic coding, or ICD-10-CM coding, but all we need to know is where the tumor was and if it was removed, and if anything else was removed with it in terms of the organ or a organ. So for our purposes, saying the patient has a left adrenal tumor is fine. That just gives us the information of the anatomy. The top, at the very top of the operative report, it says laparoscopic left adrenalectomy. So that gives us a clue to the what was done and how it was done in terms of the surgical approach. We don't stop there, however. We have to verify by reading the body of the report. As you're reading the body of the report, you're looking for keywords or phrases. Again, you want to verify your root operation. This patient had at least part of an adrenal gland removed, maybe the whole adrenal gland. We don't know that yet. It says that at the top. We need to verify that. It also tells us that the patient's adrenal gland on the left side was removed with a laparoscopic approach. As we read down, we notice wording such as laparoscopic left adrenalectomy. After this was done, the adrenal gland was placed in an endo bag. So that makes us know that the patient's entire adrenal gland was removed. So the tumor was too big, it was too invasive, whatever the reason was, they didn't just take the tumor, they took the entire gland and the tumor with it. Because of that, the root operation would then be resection. So we move to our alpha index of our ICD-10 PCS coding manual. We index the main term, which is our root operation, which is the word resection. Then we use the anatomy as our subterm. We would go to the word gland and adrenal under resection. And then in ICD-10 PCS, you have to note, typically for the most part, every time if there's certain size of the body, or if we have an organ that is bilateral, which in this case most people have two adrenal glands, one on the left and one on the right. So you need to know which side or which adrenal gland was taken, and it was the left. In the alpha index of ICD-10 PCS, you're given 0GT2. And again, that's only 4 characters, so you have to go to the 0GT table to finish your code. And when you do that, you already know that you were given the body part of 2, the character value for 2 for the left. We looked and we verified that the surgical approach was laparoscopic, and that relates, if we go back to chapter 1, that type of procedure relates to what is defined as percutaneous endoscopic. When we move across the row, the 0GT2 row, we also note that there was no device left in this patient at the conclusion of this procedure. Yes, they use a device, they use something called a laparoscope, but they didn't leave the laparoscope in the patient. So we have no character value. We want to record a negative component for a character value in an ICD-10 PCS to record that nothing happened. We use the alpha character of Z. And then for this particular code, when we move across the table, there's only one option on our last character value, and that option is also nothing, basically, and that is also the character, or the alpha character of Z. So our final code for a left laparoscopic adrenalectomy is 0GT24ZZ. The second case at the end of chapter 2 is a right third toe amputation, and the physician uses the word amputation. There is no root operation ICD-10 PCS, however, it identifies amputation. So we have to look at that and verify that the root operation is detachment. We also want to find out and verify which toe. It does state it in the clinical information at the top of the operative report. We also want to know where on the toe. It says the physician documents he did an elliptical incision at the base of the toe that was made with a scalpel. So that gives us our surgical approach is open. And we know also, based on the clinical information of the body of the report, the toe was completely removed and sent as a surgical specimen. Again, it was sent to pathology, but not for a diagnostic. It was sent to pathology based on clinical practice. So when we code this in the index, we're going to use the main term of detachment. Then we're going to choose our anatomy as our subterm, which is toe, third, and right, because that's exactly where where the surgeon cut the patient's toe. And he also told us it was the full toe. In the alpha index of ICD-10 PCS, we're given 0Y6T0Z. And if we review that, that's only 6 characters. So we need that 7th character. The only way we're going to get the 7th character is to go to the 0Y6 table and then follow the row that relates to T, 0, and Z. When we do that, we find that the last character value is going to identify either 0, 1, 2, or 3 for complete amputation or detachment, or high, mid, or low. Depending on which publisher you have, which version you're using, your 0Y6 table may be on 2 pages. Typically in the AHIMA version of the coding manual, if a table is going to go over onto the next page, there's red bold font at the bottom saying continue on the next page or something like that. So you want to make sure if you have a table that's on more than 1 page that you're looking at the full table before you're making your decisions. So again, in the operative report, the physician used the word complete. The toe was completely removed, which means he removed all the components that relate anatomically to the toe. He didn't just take the distal portion of the toe. So we would choose our final character value would be 0. And our final code then is 0Y6T0Z0. And then for the last chapter we're going to talk about in this part 2 of this review presentation is chapter 4. In this particular chapter, your authors are now highlighting specific root operations. They have 5 of them they're highlighting, which are release, transplantation, reattachment, transfer, and reposition. I just want to mention it's also very important that you are really taking the time to code the non-graded exercises at the end of the chapter. As we get further into the semester, some of those exercises will be used for graded events, and you'll be given that information for your assignments. But again, as I stated in the part 1 presentation, the best way I know how for you to learn to code is by coding. And the only way you learn to code is by coding exercises. So if we look at, for example, the exercise number 3 at the end of chapter 4, and I'm looking at the section at the end of chapter 4, and all of your chapters in this book, you have a section called Check Your Understanding. Most of that begins with some multiple choice questions, and then they have a subsection of that exercise area called Which Root Operation Is It? And that's where we're looking at. So we're looking at number 3. The full statement in your textbook says a 17-year-old soccer goalkeeper is admitted with diabetes in coma, causing a fall and trauma to the right shoulder. A dislocation is diagnosed and an open reduction is performed to repair the shoulder. Again, our focus is only on the procedure. We're not coding the diabetes or the fall. That would be a component of the ICD-10-CM. And yes, as a coder, you would code that too. But in terms of our learning process, we are focused only on the procedure in this class. And so we're just going to code the open reduction of this patient's dislocated right shoulder. We have to match up what we're given in this very short statement. We have to match up this idea of fixing a dislocation to one of those 31 root operations. And when we do that, we find that the best match is the root operation of reposition, which is putting something back to the anatomical way it should be. So that's one of the first steps, and then you would go through the coding process. But the first step is always to think about what is the root operation based on your clinical documentation. If we also look at number 4 before we fully code these, number 4 states a patient has a bilateral flexion contractures of the knees at 40 degrees. Posterior capsulotomy via incision is performed on both sides. So as you're asking yourself, okay, what is a capsulotomy? We do know the anatomy of the knee, but you need to figure out, so to speak, what does that word capsulotomy mean? And you may want to break it down from a medical terminology using the suffix to identify what does that mean. They're cutting into this patient's knee. And what does contracture mean? And what that means is that this patient's knee is basically stuck at 40 degrees. He can't flex his leg, him or her, the patient can't flex their leg normally. It's on both sides, and they're going to have to cut in to release the capsule that is contracted, is not allowing the patient to move their leg. So the root operation is the root operation release. If you move on to number 7, and remember, the full answer keys are provided to you in the course unless that particular exercise is part of a graded assignment. In your coding textbook, the ICD-10 Pieces of Applied Approach, the odd answers, I believe it's the odd answers for the chapter exercises are provided in the back of your textbook. But the even ones you would have to get from the answer key provided in the course. For number 7, at the end of chapter 4, it reads, a patient has a malunion of an intertrochanteric fracture of the right hip which is treated with a proximal femoral osteotomy by incision. Again, at this point, you're being asked in the exercise, you're asked first to identify what is the root operation. So this patient had a fracture of the hip that did not heal properly. They have a malunion, and they're going to fix this malunion by making an incision into the bone called an osteotomy. When we look at those root operations back in chapter 1, and we know what a malunion means in terms of a definition, the best fit is the root operation of division, which is defined as cutting into a body part without drawing fluids or gases from the body part in order to separate or transect a body part. So in chapter 1 of your textbook, the definition is identified as separating without taking out a body part. So they're going to separate by doing this osteotomy, and they're not taking anything out of this patient. They're not taking out bone. They're cutting into, in this case, bone. And a key element is the terminology in that particular exercise that states osteotomy by incision. In this particular case, when we go through the coding process, the final code is 0Q860ZZ. Again, you would index by the main term, which would be the vision, and then the anatomy. And it says by incision, so you have to make that connection with the surgical approach. What does that mean from a surgical approach standpoint, the word by incision? Number 10 in this particular area of your textbook is a patient who had a mastectomy on the right side now, so she had this in the past. A patient who had a mastectomy on the right side now presents for an open reconstruction procedure involving a pedicle flap of the transverse rectus muscle to the mastectomy site. So you're coding this second procedure, so to speak. You're coding this open reconstruction. You're not coding the mastectomy. That happened in the past. That was on another chart coded at that time. Now you're coding the second reconstruction. What is the root operation? So they're taking this patient's rectus muscle and they're going to put it at the mastectomy site to reconstruct that area of her body. That root operation is transfer, which is moving without taking out all or a portion of a body part to another location. So they're taking the rectus muscle to the mastectomy or breast area, another location to take over the function of all or a portion of the body part. And when we go through the coding process, we index by the main term of transfer and then the location, the anatomical location. The final code assigned is 0KXK0Z6. At the end of chapter 4, you have, I believe, 2 case studies or operative notes. The first one is a patient who has a deformity or a defect of their nose after having had a skin cancer removed. The procedure noted in the operative report is identified as reconstruction of the nasal tip defect. They're talking about a surgical defect that was created by removing that cancer. Reconstruction of a nasal tip defect with axial patterned forehead paramedian flap. In this particular case, the word flap is important because, again, this patient has a surgical defect from having had cancer removal, and they're going to reconstruct part of this patient's nose. Important terms and phrases in that particular operative report, in the body of that operative report, it states the forehead flap centered around the left vascular bundle. Flap was designed to fit into the nasal defect. Incision around the previously marked forehead flap of the skin and the subcutaneous tissue. And you also need to know the depth, that's why the skin and subcutaneous is highlighted in this particular slide. The flap was elevated, the flap was rotated into the defect and secured. So they're moving a piece of this patient's forehead, taking a piece of this patient's forehead and moving it to cover this defect. The root operation that matches that is transfer, which is defined as the moving without taking out all or a portion of a body part to another location to take over the function of all or a portion of a body part. So we index the main term of transfer, then we use the anatomy. Again, the depth and where this was at anatomically was the face, but it was the subcutaneous tissue and the fascia that was being reconstructed with this flap. In the alpha index, we are then given 0JX1. And again, we use the subcutaneous tissue and fascia subterm because of the documentation of that in their clinical information. To finish our code, we go to the 0JX table. We already have the body part value from the alpha index, which was 1. Next, we need to select our surgical approach. This physician did all of this by an incision, which equates to the surgical approach of open. So we choose 0 for surgical approach. So at this point, our code is 0JX10, but it's not complete. We still need 2 more characters. The next character value, when we go to that table and go across, we only have the option of Z, which is a no device. There was no device left in this patient at the conclusion of this procedure. For this particular code and table, at this particular row, the last character value has a positive component. It can have a positive component. It identifies the depth of tissue. So you're coding it basically twice, So you can have the character value choices of B, C, or Z for that last qualifier character value. B means this patient's skin and subcutaneous tissue. C means skin, subcutaneous tissue, and fascia. And Z equals no qualifier. So if we go back to our clinical information, it was denoted to be skin and subcutaneous tissue. So we choose B as our final selection for our last character value. And we have the code of 0JX10ZB for this fixing of a nasal tip defect with a flap from the forehead. So coding, in summary, coding is really about a process. You do the same steps, the same methodology, so to speak, every time you code, whether you're coding as one sentence statement in a coding exercise or you're coding a real or simulated operative report. You're doing the same process. Sometimes you have to dig a little deeper when you have a full operative report. But you still go through the same steps. And at this point, it's important that you also are using what I like to call the 2-step process when you get to the coding manual. You are using the alpha index and then moving to the table. Once you become an expert, you've been coding for 5 years at ICD-10 PCS, you certainly could take this shortcut and go right to the table because you may have memorized some tables by that time. But that's not something you need to do right now. So you must use, or you should really use, the alpha index. And the best method, I know sometimes we like to code by the procedure name, like colonoscopy. But sometimes that leads us down the wrong path. So the best options identified in the coding textbook is that you index by the root operation using that as your main term and not using the word bronchoscopy or colonoscopy. There are some exceptions to that. Bronchoscopy, I believe, is one of them, but colonoscopy is not. Sometimes students use colonoscopy and they end up getting the wrong code. The other reason is typically you don't get a full 7-character code in the alpha index. You typically only get part of a code. So it is a 2-step process at this point in your learning, and I encourage you to go through that process every time you code something, whether it's an exercise, whether it's a paragraph, or whether it's an operative report. So I hope this presentation helps you moving forward into the next step of the semester. If you have any questions, you certainly can contact me via the Canvas inbox feature or post to a lesson form related to where this particular presentation is found in the course. Thanks.